Hello, this is Dr. Kundlas. Today, I will reveal to you one supplement with 8 very powerful metabolic effects on your proteins, fat, and glucose. It is as good as natural Ozempic. Today, we will be discussing about berberine. Fortunately, I have been creating a lot of videos regarding cholesterol, and thanks to my patients who brought this gem of alternative medicine to my attention. As a physician for last 27 years, I have been ignoring food, nutrition, supplements, spices, and since I started making YouTube video and interact with my patients on daily basis, they requested me to create a video about berberine. Thanks to them, and it is dedicated to them. What is berberine? And I have spent a lot of time that you're getting evidence-based information. Berberine is an alkaloid or a sap coming from a plant, Berbis vulgaris, and this plant is unique. Traditionally, this has been used in Ayurvedic medicine and Chinese medicine for a long time to treat infections and inflammation. In modern medicine, since we have much maximized the medications and there is a lot of push regarding whether allopathic medicine should be used for every condition. So people are exploring alternative ways. And now there is some money going into research to find out this natural products which exist, and if we incorporate into our day-to-day activities and our food and nutrition, it can help. We are interested how berberine can help to control our metabolic health, blood sugar, cholesterol, and fat. It is about bright yellow in color. The way it works, that is where the whole magic lies. It has a lot of chemical pathways. I will list them: that it activates AMPPK, that's a master switch, the mitochondria, which are the energy powerhouse of each cell in you, and you are made up about 60 to 70 trillion cells. It affects you there. It controls your glucose metabolism, both how much sugar your muscles are going to pick it up from your blood sugar, and also how much liver is going to make. It also promotes autophagy, that all the gunk and the dead material which we have collected in our body, it cleans it up and it improves our vitality, and we feel good and we prevent aging and we live long. Then it also enhances the muscles, which I have explained, to pick up more glucose. Above all, it improves gut microbiome and the inner lining of your gut. That way, it prevents a lot of inflammatory bowel disease, inflammation, and is directly related to metabolic health. It is like PCSK9 medication, which is very, very powerful to help you lower your cholesterol. And by acting on tumor necrosis factor and interleukin, it lowers the inflammation. But this is the chart, which is a simplified version where it explains everything, how this thing part. This is the chart where it explains how different organ systems get involved. Let's dive deep into that. First, metabolism. Remember, I told you that body has a metabolic switch which called AMPK, and all the anti-aging medications research is geared towards how we could activate AMPK, and your berberine does that naturally. Think AMPK as body's fat burning switch. When AMPK gets activated, you start burning your fat. So I'm not saying that this is a panacea. What I'm saying is these are the mechanisms we should explore and we should incorporate into our day-to-day life. Further, berberine also help you to convert this fat into energy, so you feel more active, more vital, and you are more full of energy and vitality. How berberine not only switching the fat metabolism, how it promotes the energy level. It is postulated that the mitochondria in the cell, they become more effective, they become more efficient. so that they start burning the fuel and you feel much better and you start improving. Berberine is known to lower your sugar. It does by two things. Number one, it makes your muscle pick up all the blood sugar from your blood, and also it promotes your liver to stop the process of converting proteins and fats into sugar. You might have a normal experience if you're diabetic, that you wake up in the morning, you have not eaten, and your blood sugar is high. This is because your liver is converting your fat and protein into liver. And your liver is converting your fat and proteins into sugar, and berberine stops that. Berberine prevents aging. What is aging? In aging, all the senescent cells and all the dead cells, they are just not cleaned out of the body. They are just getting piled up, cumulated, leading to degenerative diseases. And by signaling the pathways, it cleans up the old gunk and your body becomes new, rejuvenated, revitalizes, and it improves out of it. I have went over in detail that how stimulates the receptors in the muscle. They pick up sugar from the blood, and then your blood sugar goes down, and so has all the complications of the diabetes. Berberine is especially important for your gut health. What it does is the inner lining of the cell, there is a lot of interest in leaky gut syndrome or SIBO. It heals you there. Further, it also promotes the good gut bacteria growth. So once your gut is healthy, your mind is healthy, your mood is better, and you have a lower metabolism, you have a lower inflammation. Berberine is very effective in lowering cholesterol. In cholesterol metabolism, there are two parts to it. Number one, liver is the site which makes 80% of the cholesterol. Then when the cholesterol gets released, whatever is used, that's taken out of the circulation, the extra cholesterol is clogging up our arteries. And our HDL cholesterol brings this cholesterol back for recirculation, reuse, or destruction. But the receptors which enable liver to pick up this extra cholesterol or bad cholesterol coming to the liver depends on PCSK9 protein, and berberine stimulates that. So by improving cleaning up your extra cholesterol in the body, berberine is very effective in lowering your cholesterol. Berberine decreases inflammation, all the inflammatory markers. It reduces the production of them. Inflammation goes down, pain goes down, chronic diseases goes down. This is the buzz line. Is berberine really nature's Ozempic? And my honest view is Ozempic is a very powerful drug, and they both work on different places. Ozempic works on a GLP receptors in the body, and they improve your insulin, they decrease the stomach size, they improve the satiety. So it does everything that your sugar goes down. Whereas berberine activates AMPK system, and then it also decreases the appetite. So like Ozempic, it's a halfway there. They both decrease your appetite, but it is not as powerful as Ozempic. But if you combine them, I think the effect will be synergistic. And I'm answering this question particularly to one of my patients who has been combining both of them, and he has a very good result. And good part is he does not have any significant side effects. The major side effects of berberine is GI, nausea, vomiting, diarrhea. Those things can happen, and if you're pregnant and breastfeeding, you should not use any berberine product. These are the kind of mechanisms which I have went over already, like how it increases this healing or metabolic pathways is all these parts. It promotes your liver to produce good cholesterol, destroy bad cholesterol, stop conversion of fat and protein into glucose. It makes muscles to pick up more sugar out of your blood, all the proper ways. This is another concept which is very important. that how berberine helps nutrition partitioning, muscle versus fat. See what happens when we eat the sugar which gets into a circulation. It has two phases. A, it can be used as a energy by our cells, especially our muscle cells, or it could be stored as fat. By improving AMPK pathway, it pushes the sugar into muscles so that they could burn. By that, there is a less of fat and you lose fat and you lose weight. And the reason we use berberine in polycystic ovarian syndrome. How to take berberine? Berberine comes about in a tablets and capsule. Each is about 500 and it's recommended to take 2 to 3 times a day. This berberine does not get absorbed from the gut very quickly. That's the reason you have to combine it with some other product. We all might have heard milk thistle. It combines the silymarin, which is in the milk thistle. When they are taken, they promote the absorption of berberine. Usually, it's recommended take for 6 to 8 weeks, then stop for 2 weeks, and then you could circle back. The process is these are the new supplements and trying to limit the side effects. Can berberine help you lose weight? It definitely can help you lose weight. In clinical trials, there was 2 to 5 kg. It improves all metabolic pathways. It mobilizes fat, does not let the fat deposition. It makes muscle pick up more sugar, and above all, it decreases inflammation. And also, it decreases appetite and it helps. Can you make berberine naturally? No. Berberine only exists from the berberis plant. It does not, you cannot make it, and it is very safe to take it. Can berberine be used as an alternative to metformin in PCOS? In the studies which I could get, they have tried that and they were successful. The trials were positive. But I cannot make the recommendation replace one over the other. Berberine definitely improves insulin sensitivity. It does improve symptoms of PCOS and it could be either replaced or could be used with metformin. Berberine lowers your bad cholesterol, decreases triglycerides and total cholesterol. It inhibits PCSK9. That's why more bad cholesterol could be picked up by receptors in the liver and lower your cholesterol. And also, it improves the function of inner lining of your blood vessels. It is very good alternative in patients who are statin intolerant. Safety and side effects. Common side effects are GI, constipation, and cramping. We should not combine it with blood thinners and certain blood sugar lowering medications. Pregnant women and breastfeeding and infants are absolutely contraindicated. It is recommended that people who are taking long term they should have liver tested, sugar tested, and cholesterol check tested every 6 months to a year. I have no formal recommendation way to buy. My goal was to help you get the science behind this thing, but these are the good resources which I was able to find. In nutshell, berberine could be helpful in treating type 2 diabetes mellitus, polycystic ovarian syndrome, high cholesterol, weight metabolism, weight loss and metabolic syndrome, gut inflammation, longevity and anti-aging. I hope that this video was helpful and informational. My name is Dr. Kulmeet Kundlas signing off and I will see you in next video. Like, share and subscribe to our channel Kundlas MD. Thank you very much for your attention and thank you for my all patients who have been very helpful in getting my attention to these natural supplements and ingredients. Thank you.